Okay, so now we're going to show you how to find the correct working end for the posterior teeth. So I always get my correct grasp with my modified pin grasp, and then I set my fulcrum down on the canine. Then I extend the tip of my explorer back interproximally between two teeth, and I'm looking to see if the terminal shank is parallel or not. So the terminal shank is just right down there at the end. So this one doesn't look super parallel, but I'm going to check the other end. So again, getting a good grasp and then setting my fulcrum down on the canine and extending my tip interproximally. And as you can see, that terminal shank is a lot more parallel to the long axis of the tooth. So then I know that this is the correct working end for this area. And then with exploring posterior teeth, we're always going to start at the distal line angle like this with the tip, and you're just going to gently slide the tip right underneath the gums right there, and you'll do your little strokes back to the distal contact and rolling as you go. And then I've hit the contact, so I'll come out there. And then I'm going to pick up my instrument, readjust it to go towards the mesial. I'm going to start at the distal line angle again, and we'll just do these little strokes all the way to the mesial, making sure that I stay under the gums and hit the junctional epithelium on every stroke. And just really light grasp, light pressure with this. And then I've reached the contact there, so I will come out there. And then how you do your horizontal strokes is you have to take your fulcrum and lay it down, and your instrument handle should be horizontal. So for the vertical strokes, your instrument handle is more vertical. For horizontal strokes, you're going to lay it down horizontally. And then you're going to start at the distal line angle with the tip down, and you should see some blanching. You don't want to drag it along the bottom of the junctional epithelium, but you should see some blanching, making sure you're under the gums. And you'll just do little strokes like that at the distal line angle. You'll pick it up and adapt it to the mesial, and you'll do little strokes like that on the mesial line angle. And then for anterior teeth, for the horizontal strokes, again, you're going to make sure that your instrument curves into the tooth. And you also want to make sure that your instrument handle is horizontal. So for the other strokes, it will be vertical like this. For horizontal strokes, your handle's horizontal. And you just do the midline, so you just insert that tip right along underneath the gums, and you just do overlapping strokes right here at the midline.